from my perspective, what happens is a patient calls, they make an appointment, they call, and we have like a set number of virtual consults that can be done at any given day and a set number of in-person consults. My current ratio, I do about 10 to 11 consults on any given day. I actually do blocks where all the consults are in the afternoon. I currently have 6 of my consults are virtual and 4 of them are in person. Things that work really well for virtual consults are wisdom teeth and dental implants and extraction of teeth. And with dental implants, it's more of the routine cases than the really complex, although I've done those as well. Whenever I do a virtual consult, I always use a Sharpie on the paperwork so that when I come back later, I have a visual cue that I know that that was a virtual consult, and that I need to make sure that if I didn't have the x-ray on that day, I can go through and just highlight if there's any changes based on an up-to-date x-ray. So if I have the radiograph, then it allows me to obviously code out the type of extractions, and it also gives me a prompt to kind of show patients through the video screen. If I do not, then the first thing I ask for wisdom teeth is, can you feel the tooth poking through the gums or can you not? If they say I cannot feel them poking through, they're all underneath the mucosa, then I know that I'm going to code those out as complete bony extractions, because that's the highest is what they could be. So when it's time for me to do the consult, I basically, just like a regular consult, come up, the assistant gives me a little breakdown of like, okay, here's the patient, here's the situation, here's what's going on, and I come in. And then I sit down in front of the video screen and we talk. At that point, they've already filled out their health history online, their medications were filled out at home, their surgical history, they've signed their HIPAA policy, the financial policy, they've watched the informed consent videos, and the app automates all of that prior to the appointment. So then I go through it and I just do my regular consult. I talk about risks versus benefits, talk about the surgical procedure, about the anesthesia if appropriate, and if it's dental implants, talk about whatever it is I want to talk about in a normal consult. At the end of my normal chit-chat with the patient, I then turn it over to the surgical assistant, and the surgical assistant essentially does the same thing that they normally do. They're just talking to the video screen to the patient through the video.